Welcome to this edition of Silver Sneakers Boom Muscle. I want to discuss an issue I've had recently. Just this past week, I developed some left-sided flank pain, that is on my back, but towards the side, which is different than my usual back pain, which is sort of more in the center of my lower back. I often get that if I neglect doing enough core exercises, abdominal crunches, planks, exercises like that. Well, I've been doing those quite a bit. This pain would make it extremely uncomfortable at night when I was trying to sleep, couldn't find a comfortable position. But then it would go away. And like the next day, I'd feel fine. I could do my activity. I was cleaning our outside windows, getting ready for winter, climbing up a ladder, scrubbing the windows, bending all around, and it's so odd. And then yesterday, when I was urinating, I passed a little blood clot. That made me think, oh, maybe I've got a kidney stone, which could happen. And so I went into urgent care. They did a urinalysis, some blood test, and a CAT scan looking for a kidney stone. Didn't see any stones, but I had noticed prior when I was urinating, I had passed a couple tiny little pieces of gravel, so maybe the whole thing is resolved at this point and I feel fine. The reason I wanted to discuss it was as we become seniors with problems with our bladder, prostate issues, incontinence, all these other things, we have a tendency to not drink as much fluid because we don't want to be going to the bathroom as often or having episodes of accidents. The consequence of that is we can get dehydrated, and that has a tendency to form kidney stones. So it's a compromise, trying to get the right amount of fluid without making your life too uncomfortable. One thing I would recommend is you can get a dipstick for urine testing. You can do it at home off the internet. They're pretty inexpensive. Every once in a while, check and see what your specific gravity is, as opposed to saying, well, you need to drink 8 glasses of water a day or 10 or whatever. Often you want to be very well hydrated, but without overdoing it. So on these dipsticks, you want to get a reading that is 1.020 or less, more dilute. I found that I typically am around 1.030, so pretty concentrated. So that could be why I was starting to form these little tiny stones. So I've resolved to increase my water intake, even if I'm not thirsty, and just resolve myself to going to the bathroom more frequently. Kidney stones are terribly painful. You don't really want to go through that. But also a condition you don't want to ignore because they can be quite serious. Sometimes you can't pass the stone, and the urologist will have to do a surgical procedure to remove the stone, either with ultrasound or putting a scope in, pulling it out, sometimes even open surgery. So it can damage your kidneys, so it's very important to get the right amount of fluid in. So trying to maintain our health, increase our activity, maintain muscle mass as we are in our senior years is rife with problems, but it's worth doing. As you've been following me, you might know that I like to combine my resistance exercise with action intervals. And so today I'm going to do a series of exercises like a circuit, doing 40 seconds of resistance exercise at a pretty good pace, followed by 20 seconds of rest, which is a strategy we call every minute on the minute we resume exercise. With that 20-second rest, or 2 times the rest interval as action interval. And we'll see how this goes. I'm going to do our 5 basic movements, which are squat, push, pull, rotation, and one-legged exercise like walking, farmers carrying a mass. For the first of our fundamental movements, I'm going to do a clean and press using a medicine ball. I like these ones with the handles, but you can use medicine ball, dumbbell, or barbell. Okay, go ahead and start.
And we'll go for 40 seconds. Want to make sure you do a good squat position. You can modify it by not going as deep in your squat, using a lighter weight, or even no weight at all. Got about 10 seconds left. Okay. 20-second rest interval, and we're going to go into incline push-up. If you get tired, just hold it as a plank until you can do a few more. Okay, 40 seconds. Hold the plank for a few seconds. Ten seconds to go. And a 20-second rest. Next I'm going to do a pulling exercise using a TRX. You can use a band or a machine or whatever. Yeah. 40 seconds. And 10 seconds to go. For rotation, I have a band attached to this pole. You can just use a band, set up about waist high, and we just rotate with it. Okay. And we'll go for 40 seconds. If you're going to do a second circuit, you would switch to the other side. In this case, on demonstration, halfway through, I'll switch to balance it. A 20-second rest. For a final interval, we'll do a farmer carry, otherwise called a suitcase carry because it's on one side. You can hitch it up. This is a waiter's carry, and we'll walk back and forth. And on each lap, switch arms. I like these one-sided carries because it requires you to engage the core. To keep from falling over. And a 20-second rest. And ideally, you can repeat that circuit 2, 3, 4 times to get your full workout and follow it up with some mobility. So that's all I'm going to do for today. Hope you enjoyed this short video, and see you next time.